Good morning, wherever you are. This is Riley Knox from ConferenceHype. Our segment will focus on the effect of older age and stage on risk of recurrence and mortality following curative resection in a national cohort of patients with colorectal cancer. From the 2026 Jul 21 edition of British Journal of Cancer. Background: older patients are routinely excluded from clinical research, limiting understanding of recurrence and mortality in colorectal cancer patients over 75 who undergo curative major resection. Methods: using linked data from national cancer, treatment, and administrative datasets, we estimated recurrence, CRC-related and non-CRC mortality to 5 years after surgery for patients selected for curative resection in England between 2014 and 2020, who survived 9 months. Results: 50,480 patients had curative resection, 15,496 aged 75. Discussion: cancer stage was the strongest predictor of recurrence and CRC-related death. From the 2026 Jul 23 edition of British Journal of Cancer. Background: limited knowledge exists on the association between hospital contacts before a childhood cancer diagnosis and the risk of early mortality. Methods: we conducted a register-based cohort study, including 14,089 children with cancer diagnosed in 1989-2014 in Denmark and Sweden. Results: children hospitalized greater or equal to 14 nights within 2 years 14 days and 3 months 14 days before cancer diagnosis faced elevated ORs of early mortality. Discussion: children with increased time in hospital before cancer diagnosis had a higher risk for early mortality, which indicates underlying health vulnerabilities or pre-existing fragility in this population. From the 2026 May edition of British Journal of Cancer. Background: nivolumab is effective in treating patients with esophageal squamous cell carcinoma. Methods: in this phase 2 trial with Simon's two-stage design, neoadjuvant nivolumab, paclitaxel, and cisplatin were administered with radiotherapy followed by esophagectomy to patients with locally advanced ESCC. Results: a total of 17 patients were enrolled in stage 1. Discussion: nivolumab in combination with neoadjuvant CRT is safe for patients with locally advanced ESCC and may be beneficial in those with high PD-L1 expression. From the 2026 Jul 23 edition of British Journal of Cancer. Background: the aim of the article was to analyze the trends in oncology interventional clinical trials in the United Kingdom from 2000 to 2025, compare with major global regions, and to assess the potential impact of the new UK Clinical Trials Regulation 2026 regulatory reform on the future competitiveness. Methods: retrospective observational analysis of interventional oncology trials registered on clinical trials, GOV with comparison across the UK, European Union, the United States, and the Republic of China. Results: the UK experienced growth in oncology trials until 2017, followed by declines associated with Brexit and the COVID-19 pandemic and partial recovery thereafter. Discussion: despite recent challenges, the UK retains strong infrastructure and expertise in oncology research. The 2026 regulatory reform may support the future attractiveness of the UK, particularly for early-phase trials, although increasing global competition remains a significant issue.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 Jul 23 edition of British Journal of Cancer. Gastrointestinal cancers account for 1/5 of all cancer cases and 1/3 of all cancer-related deaths worldwide. Despite this, The number of systemic treatment options for these cancers remains overall low compared to other cancer types. Antibody-drug conjugates, which are composed of a cytotoxic payload attached to an antibody via a linker, have emerged as a promising class of drugs for cancer therapy over the last decade, leading to several approvals in solid tumors and hematological malignancies. However, their development has been delayed in GI cancers compared to other frequent cancers. Encouraging clinical activity has been recently reported with ADCs targeting Claudin 18.2, CEACAM5, and MET. Switching from tubulin inhibitor payloads to topoisomerase inhibitor payloads in the last generation of ADCs seems to increase the overall activity in GI cancers, particularly in adenocarcinomas. From the 2026 JUL 24 edition of British Journal of Cancer. Background: tumor-associated macrophages are an indispensable part of the tumor immune microenvironment, exhibiting phenotypic and functional plasticity that enables them to play an important role in modulating the immune response. Methods: in this study, we mainly used genetically engineered mice to demonstrate how host ApoBEC3 deficiency affects tumor progression. Results: we found that the polarization state of macrophages in the tumor microenvironment was altered by host ApoBEC3 deficiency, and that knockout of host ApoBEC3 significantly inhibited tumor growth and metastasis in a macrophage-dependent manner. Discussion: these findings reveal that ApoBEC3 deficiency drives lipid metabolism reprogramming in macrophages and remodels their functions, thereby inducing a strong anti-tumor immune response, providing a proof of concept and new insights for the development of the ApoBEC3 family for novel tumor therapies. From the 2026 JUL 21 edition of British Journal of Cancer. Background: non-invasive biomarker-based approaches are urgently needed to support early identification and monitoring of oral squamous cell carcinoma and its precursor, oral submucous fibrosis. Methods: we employed combined metabolomic and proteomic analyses to profile saliva and lesion surface swabs from clinically diagnosed OSCC, OSMF, and healthy controls. Results: distinct molecular changes were observed across the health-to-cancer spectrum. Discussion: our combined metabolomic and proteomic profiling revealed non-invasive molecular signatures for early detection and monitoring of OSCC and OSMF. From the 2026 JUL 24 edition of British Journal of Cancer. This consensus by the CSCO Pancreatic Cancer Expert Committee establishes evidence-based guidelines for molecular testing in pancreatic ductal adenocarcinoma. It details recommendations for biomarkers, liquid biopsy, and precision imaging to direct targeted therapies and immunotherapy, aiming to standardize diagnosis and optimize individualized patient care. Pancreatic ductal adenocarcinoma is the most common pathological type of primary pancreatic malignancy, accounting for 95% of cases and generally referred to as pancreatic cancer. Its prognosis is extremely poor, and its incidence continues to rise. According to the most recent global cancer statistics, the incidence of pancreatic cancer ranks 12th among all cancers, and its mortality ranks 6th, making it one of the deadliest malignancies worldwide. Approximately 57% of patients have metastatic disease at diagnosis and require systemic therapy, for which chemotherapy remains the standard first-line option.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 JUL 26 edition of British Journal of Cancer. Background: relapse remains the leading cause of treatment failure in B-cell acute lymphoblastic leukemia, highlighting the need for biomarkers and therapeutic targets that limit leukemic dissemination. Methods: HDAC6 expression was analyzed in cohorts of 72 pediatric and 54 adult patients with BALL and validated in BALL cell lines. Results: HDAC6 expression was elevated in BALL cell lines and patient samples and was significantly associated with relapse in both patient cohorts. Discussion: HDAC6 is a clinically relevant biomarker associated with BALL relapse and a critical regulator of cortex-independent leukemic dissemination. From the 2026 JUL 22 edition of British Journal of Cancer. Background: Introduction: familial adenomatous polyposis confers high periampullary malignancy risk. Methods: 51 FAP patients underwent esophagogastrogioduodenoscopy with protocolized routine duodenal papilla biopsies, independent of macroscopic findings. Results: ampullary adenomas were detected in 62.75%. Discussion: routine papilla biopsy significantly improves adenoma detection in FAP patients, especially with transparent caps. From the 2026 JUL 25 edition of British Journal of Cancer. Background: chemotherapy-induced thrombocytopenia compromises cancer care, but data on its management in children is scarce. Methods: we conducted an investigator-initiated, open-label, randomized control trial at a tertiary center in India to evaluate prophylactic romoplastim for prevention of CIT in children aged 1-14 years with acute myeloid leukemia, non-Hodgkin's lymphoma, and solid tumors receiving myelosuppressive chemotherapy. Results: from March 2023 to October 2024, 93 patients were randomized. Discussion: prophylactic romoplastim didn't hasten platelet recovery in pediatric patients receiving myelosuppressive chemotherapy, but was associated with reduced bleeding and had lower transfusion requirements. From the 2026 JUL 23 edition of British Journal of Cancer. Background: despite the widespread clinical use of prostate-specific membrane antigen-targeted imaging and therapy in prostate cancer, the biological functions underlying PSMA-associated tumor aggressiveness remain incompletely understood. Methods: PSMA PET-guided sampling of paired PSMA-high and PSMA-low tumor regions was used for integrated proteomic and epigenomic analyses. Results: PSMA-high tumors exhibited lipolytic reprogramming characterized by ATGL upregulation, confirmed by a robust PSMA-ATGL correlation in the validation cohort. Discussion: ATGL-mediated lipolysis represents a promising therapeutic target in prostate cancer, with heightened sensitivity in tumors lacking metabolic flexibility to utilize alternative pathways.
This is Conference Hype. Stay with us, coverage continues.
That's it for now for ConferenceHype's coverage of the July 2026 issue of British Journal of Cancer. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.